Most of you have been asking one common question in my feed. What are those top 5 procedures that as a plastic surgeon, I would recommend to my patient? Hi, I'm Dr. Deepthi, consultant plastic surgeon, and today let's discuss what would be those top procedures that I would recommend for most of my patients. So, even in aesthetic plastic surgery, though we do this for cosmetic reasons, there are few procedures which I personally consider essential for people rather than more for cosmetic reasons. Let me tell you what are those procedures and why they are useful for you. The first and foremost procedure that I advise for all the patients in case they have this problem to consider is breast reduction in case of a heavy breast. I have seen many girls walking to me at a very later stage after they have lived with a heavy breast for many years and coming to me with severe backaches and neck aches, and they kind of really get shy to open up with this issue with their family members or their spouses. And in most of the cases, I hear their family members saying, "Why do you need plastic surgery? You're all fine." Yes, she is fine, you are fine. But in case you have a heavy breast, imagine you're almost weighing around 5 kgs or 4 kgs of weight around your neck 24 hours even while sleeping. What kind of a pressure does it cause on your back? And also mentally, this is so very embarrassing to cover up that heavy breast all the time and go into workplaces and schools. Many girls in their adolescence have come to me saying they're not able to go to school because of this issue at all. So I don't see any reason why a woman should suffer with this problem when we have really good techniques today in today's day to treat this problem without causing any kind of long-term issues. Breast reduction is a very meticulously planned surgery. It has a proper planning without disturbing any of your core breast tissue, its blood supply or nerve supply. The surgery finishes in around 2.5 to 3 hours and done under very safe anesthesia. So please, in case you have a heavy breast, consider this as a primary option. Don't think it's an aesthetic plastic surgery. It is a very essential plastic surgery. Next comes tummy tuck. Tummy tuck is one of the most dreaded surgery by all the patients. Let me tell you the truth. Tummy tuck is done as a procedure to tighten up your core muscles, and then we tighten up the loose skin so that you have a very flat tummy to the outside. But the real advantage here is that I'm tightening up the entire core muscles in this procedure. So this helps you from any kind of unnecessary bloating or any kind of unnecessary bulging of your abdominal muscles, which causes a slouch position while you stand up, and this causes unnecessary pressure on the spine for a long term. Again, this is causing wear and tear over your spine bones and the muscles there, causing back pains in the long term. So this procedure, the main advantage of this procedure is that we are tightening up the core muscles and giving you an upright, straight position, which will reduce the pressure on your spine. In case you're thinking, should you go for a tummy tuck or not? Leave the aesthetic concept of it. The core tightening part of it is very useful functionally and would make your life 100 times better and will give you a very good energetic and straight position all through your life. Please consider this. Next procedure, or the third procedure, would be rhinoplasty. Why rhinoplasty? Yes, this is an aesthetic procedure, but I have seen in most of the cases that a small subtle change in your nose can soften your face a lot. Nose is always the center of your face and it can change the expression of your face very drastically. So in case you're unhappy with your face or anything is bothering you about your face, sometimes rhinoplasty can give a very remarkable change in the face without a great damage. So try considering rhinoplasty in case you want to pick an aesthetic procedure for your face. Next comes breast augmentation, especially through silicone implants and especially in post-lactational women. Breast is subjected to involution of the breast. So they see a lot of reduction in the breast volume and they kind of don't like that change in their body post the lactation phase. So many women who come near me basically come near me with a sense of insecurity in them, which is not needed at that stage because we have very good options like silicone implants implants. Since they have finished the pregnancy and the breast is also not subjected to many hormonal changes, a simple breast augmentation procedure will enhance their inner confidence to a massive extent. This, forget about the aesthetic component, but definitely will boost your confidence, and you can very easily get away with the implants without major changes or major transformation till at least 50 to 55 years. And one last very personally interested procedure that I'm in is jawline definition. There are certain group of procedures that we do to give a jawline definition, but if you consider them again, your face, especially in this Instagram era, looks amazingly cute when you work on jawline definition. This gives a very photogenic face and improves the aesthetic appearance of the face to a massive extent. So if at all you have to consider one purely aesthetic procedure, go for jawline definition. So this list I have given is only for generalized population, and this is not a customized list. In case you want a customized list which is suitable for you, comment in my comment box below and I'll try to reply for them, or try to meet me in person. This will be a better discussion on this. Please like the video and share it to all your friends so that they will also benefit from this.